We're going to do anterior compartment of thigh. This is part of the lower limb. Um, Moving on. So, skin is one of the most important things in the anterior compartment of thigh. Now, the anterior compartment of thigh is the region between the hip and knee joint, as shown in this image. As you can see, if you look at a cross section through the right mid thigh, looking towards the hip joint. So, this is your skin, right? And you have an anterior area, a posterior area, a lateral area, and a medial area. So we are going to study most of the anterior compartment of the thigh. The anterior thigh is divided into three compartments. The thigh itself is divided into three compartments. We have an anterior or the extensor compartment. So most of the extensors are present in the anterior compartment. Now there's a medial compartment that is also the adductor compartment. All the adductors lie in the medial compartment. And there's a posterior or flexor compartment. All the flexor muscles lie in the posterior compartment. Now, septa are like imaginations of connective tissue. The anterior and posterior compartments are separated by medial and lateral septa. So, as you can see on the cross section here, the femur is in the middle, and then we have the lateral and medial intermuscular septum that somehow enclose really big blocks of muscles and make like a packet of them in the front and the back of the femur. So the adductor muscles do not have a separate facial boundary. By facial, we mean the fascia that is making the intramuscular septum, but they're continuous with the posterior compartment. The thigh compartments, as you can see on this cross section, this is the anterior and extensor compartment, this is the medial or adductor compartments, and this is the posterior or flexor compartment. Now, the subcutaneous tissue. Under the skin, we have the subcutaneous tissue. The fat or the front thigh contains cutaneous nerves, lymphatic vessels, and nodes. The termination and tributaries of the great saphenous vein and cutaneous branches of the femoral artery. All of this lies in the subcutaneous fat. So, the fat of the front thigh contains cutaneous nerves that supply the skin, lymphatic vessels that drain the lymph, and termination and tributaries of veins that are draining the anterior thigh, like the great saphenous vein and the cutaneous branch of the femoral artery. Now, I told you there's an inguinal ligament. The inguinal ligament starts at the anterior superior spine to the pubic crest, and the medial part of this inguinal ligament is the lacunar ligament in which the femoral canal is formed. So, the anterior superior iliac spine was a ligament, the inguinal ligament originates from this bony prominence, which is the anterior superior iliac spine of the hip bone, and more specifically the ilium bone, and then runs all the way and attaches to a small bony projection on the superior ramus of the pubis, which was our pubic crest, as you can see. And this green area, the green fibers, the medial ligaments fibers, the inguinal ligament has a medial area, the medial area has lacunar fibers in which the femoral canal is formed. Now, the inguinal ligament spans between the anterior superior spine and the pubic tubercle, forming the base of the inguinal canal. And under this inguinal canal, a lot of neurovascular structures pass. Most laterally, we have the lateral cutaneous nerve of the thigh, and most medially, we have the femoral canal, which has this femoral nerve, artery, vein, and some special lymphatics. It plays a role, this inguinal ligament plays a role in anchoring the lower abdominal wall and demarcates the boundary between the abdominal and thigh regions. The fascia lata is a very important compartment of the anterior thigh. It's a deep fascia of the thigh, a dense connect. There's a mosquito here. I'm getting so irritated. So the fascia lata is a deep fascia of the thigh, a dense connective tissue that encloses the muscle like a stocking. Now, this fascia lata and some fibers from the gluteus maximus muscle. The fascia lata is a deep fascia that encloses the anterior thigh like a stocking. Now, fibers from the fascia lata and the gluteus maximus um, become together, like merge and converge into one tract, and that's the iliotibial tract. Here you can see that fibers from the gluteus maximus and the tensor fascia lata, they both add up to form the fibers of the iliotibial band that go and insert into the lateral epicondyle of the humerus. Now, moving on, the fascia lata superiorly is attached to the inguinal ligament, laterally extends from the anterior superior spine along the external lip of the iliac crest, posteriorly attaches to his sacrum, the sacrotuberous ligament, the ischial tuberosity, and the ischiopubic ramus. We're basically following the borders of the ilium and the ischium posteriorly. Medially, it's anchored to the pectineal line of the pubic bone. This was the same area from which the pectineus muscle was originating, and inferiorly continues to the tibial condyles and the head of Faber. fibula. But the facial artery is a deep facialing of the thigh, and it's really important because it's dense connective tissue that encloses the muscle like a stocking. It encloses the thigh muscles like a stocking with an upper edge modified to accommodate the bony pelvis. It forms the saphenous opening near the groin, allowing the passage of the great saphenous vein. Now, can you see here that these fibers of the facial artery allow for the saphenous opening? Now, the great saphenous vein has to come out of this facial artery into the thigh, and that opening is allowed by the anterior fascia, the facial artery. Now, to see the saphenous opening more clearly, we can see here that the saphenous opening, this is your inguinal ligament, and this is the saphenous opening. The saphenous opening is a center that is 4 centimeter below and 4 centimeter lateral to the pubic tubercle. It is about 2.5 centimeter long and 2 centimeters broad, with its long axis directed downwards and laterally. This is basically gap in the stocking of fascia lata. It's covered by cribriform fascia. Cribriform means like a strainer. You know how you have a strainer in which you put tea and then the tea leaves stay behind and the water passes through. So that's basically like cribriform fascia. Cribriform is like a chunni, right? So the cribriform fascia is pierced by the great saphenous vein and its tributaries, because obviously the great saphenous vein has to come out of this opening, and the efferent lymphatics from the superficial inguinal nodes that are draining the lymph away from the thigh. Now, muscles of anterior thigh, tensor fascia lata, sartorius, iliacus, psoas major. The iliacus and psoas major combine to form the iliopsoas muscle. The pectineus was originating from the pectineal line of the pubis, the superior ramus of the pubis. And then we have the rectus femoris, which was the most anterior muscle of the thigh. And then we have the four vastuses. We said three vastuses, vastus medialis, lateralis, and intermedialis. Now, the tensor fasciae lata is a small muscle. It's situated at the lateral aspect of the hip, closely associated with the iliotibial tract, because it's going to converge into the iliotibial tract later on. It arises from segment 5 centimeter. It arises from a 5 centimeter segment of the external lip of the iliac crest between the anterior suprailiac spine and the iliac tubercle. And this region we even did when we did the hip bone, right? So the tensor fasciae lata merges with an insert into the iliotibial tract, a thickened band of fascia running along the lateral aspect of the thigh. We also have a condition called the iliotibial tract syndrome. It happens in runners, and this is the area that gets inflamed. Tensor fasciae lata's nerve supply is by the superior gluteal nerve. The superior gluteal nerve basically passes between the gluteus minimus and the gluteus medius, and it goes to the tensor fasciae lata. So basically, the superior gluteal nerve will supply the gluteus medius, minimus, and the tensor fasciae lata. The action, basically, the tensor fasciae lata assists the gluteus maximus in extending the knee joint via the tension of the iliotibial tract. It stabilizes the pelvis during walking. It works with the gluteus medius and minimus. And you can see that the minimus and medius and tensor fasciae lata are all three supplied by the superior gluteal nerve of the sacral plexus. Now, this is basically the tensor fascia. Sorry, this is the tensor fascia lata. You can see, right? Moving on. Okay, now the sartorius. The sartorius is a very beautiful muscle because it goes all the way from the anterior superior spine and then crosses the thigh in the front and then inserts into the upper medial part of the tibia in form of gracilis. In the front of gracilis, sorry. So the gracilis is also inserting at the upper part of the medial surface of the tibia, and semitendinosus by an epineurosis. So three muscles are attaching to the upper part of the medial surface of the tibia: the gracilis, the semitendinosus, and the sartorius. These three muscles are attaching to the medial surface of the tibia. Now we have the sartorius, that you can see that it is just like I did on the previous slide. Originates from the anterior superior spine, passes the thigh, and inserts onto the lateral boundary of the femoral triangle, or you can see that on the medial condyle of the tibia. Now we've done in the thigh compartments, we've done the tensor fasciae lata, which was present most laterally, and now we've done the sartorius, right? This is the cross section of the thigh. Moving on, you can see the sartorius here basically anteriorly tilts the pelvis. Now the iliacus. Now iliacus is a special muscle because it adds up to the psoas muscle and forms iliopsoas tendon. Okay, and the iliopsoas tendon we said goes near the lesser trochanter of the femur. Now, the region of the iliacus is very easy because we had an iliac fossa of the ilium bone of the hip bone, right? So that big iliac fossa, that is this red area here, this this is the origination of the iliacus. So basically, the inner lip of all of this iliac crest. Sorry, let me go back. The inner lip of all of this iliac crest, the anterior sacroiliac ligaments here, and the ala of the sacrum. This entire ala, sorry, this entire area, the lateral part of sacrum, right? Hmm, wait a second. Too many phone calls today, guys. Okay, so the iliacus muscle, as you can see, this red area, it originates from here. This will allow the ala of the sacrum, it will allow the inner lip of the iliac crest, the entire iliac fossa. That is also enough to say that it's originating from the iliac fossa and it's inserting into the lesser trochanter of the femur via the common tendon. So it's going to merge with the psoas major and insert into the lesser trochanter of the femur. Now, let's see the movements of this muscle. Trunk flexion, right? Femur flexion. This is the iliac muscle, this is the psoas muscle, and then external rotation. All these. Can you see? So basically, the iliac muscle and the psoas major are adding up to form the action, right? So this is the trunk flexion. This brown one is the psoas major. The red one is the iliacus. Both of them are inserting into the lesser trochanter of the femur. Okay. Now, the psoas major arises from the lumbar spine and inserts into the rounded tendon into the lesser trochanter. So, I told you that the psoas major and the iliacus have the same insertion. That's from the lumbar spine and inserted into the lesser trochanter. Now, the psoas major, if you remember the lumbar plexus that we did, the lumbar plexus was originating around the psoas major muscle, and the sacral plexus was originating around the piriformis muscle, right? So the lumbar plexus is embedded within the muscle, and part of the external vertebral venous plexus is behind it, in front of the transverse processes of the vertebrae. The genitofemoral nerve emerges from the front of the muscle. The all the rest, the iliohypogastric, the ilioinguinal, the lateral femoral cutaneous, and femoral nerves, all four of them come from the lateral border of the psoas major muscle. The four lumbar arteries and veins, also the obturator nerve was passing medially to the psoas major muscle. Just an extra tip here. The four lumbar arteries and veins pass backwards and medial to the four arches and run laterally behind the psoas muscle. Um, okay, moving on. Here we can see the psoas major muscle. The iliacus is not present here. So the trunk flexion, the femur flexion, and the trunk's lateral rotation. Okay, moving on, pectineus. We said there was a very important pectineal line of pubis. It was inserting into the upper end of femoral shaft behind and below the lesser trochanter, as you can see here. Pectineus muscle. The pectineus is supplied by femoral vein and the femoral canal lie on the surface of this muscle, right? So can you see this P here? This is the pectineus muscle. So this femoral canal, the femoral nerve, artery, and vein, it's lying on the um, pectineus muscle. And this is, as you can see here, this is the deep femoral vein and this is the deep femoral artery, right? This is also the pectineus muscle shown on a cadaver. This is the femoral vein, femoral artery, the deep femoral artery, and the deep femoral vein. This is an actual cadaver. The adductor brevis muscle and anterior division of the obturator nerve lie behind the pectineus muscle. Okay. Now, this is the pectineus muscle, the pelvis anterior tilt, the hip adduction, and the hip external rotation. All are done by the pectineus and hip flexion also. Moving on, the quadriceps femoris is a group of muscles that include the rectus femoris, vastus lateralis, intermedius, and vastus medius. Okay. The rectus femoris arises from ilium by two heads. The two heads unite to form the anterior lamina of the quadriceps tendon. So there's an anterior lamina of the quadriceps tendon, and the two heads of the rectus femoris unite to form this tendon and insert into the patella through the quadriceps tendon, as you can see here. Now we have the rectus femoris right in the most anterior muscle is the rectus femoris of the thigh. Moving on, we have the vastus medialis. The vastus medialis, by its name, it's between the lateralis. It's right next to the lateralis, sorry. So it lies under the rectus femoris, arises from the lower part of the intertrochanteric line. I told you that the tracheal trochanter and the lesser trochanter of the femur are connected anteriorly by the intertrochanteric line and posteriorly by the crest. So it arises from the lower part of the intertrochanteric line and the medial lip of the linea aspera and from the tendon of the adductor magnus. All these three give origin to the vastus medialis. Here you can see it arises from the posterior femur, the linea aspera, and also some part of the medial supracondyle ridge. The muscle slopes around the medial surface of the femur, merging with vastus intermedius. It wraps itself around the medial aspect of the femur. This is the vastus medialis. Okay, it continues with the quadriceps tendon. Here you can see, while the lowest fibers lying nearly horizontal are directly inserted into the medial border of the patella. These fibers give stability to the patella. So this is the vastus medialis, okay, in between the sartorius and rectus femoris. The vastus lateralis has an extensive linear origin from the upper part of the intertrochanteric line, the greater trochanter, the lateral lip of the linea aspera, as you can see here, and also rises from the lateral supracondyle ridge. So it starts all the way from the intertrochanteric line on the anterior aspect of the femur, the greater trochanter, the lateral lip of the linea aspera, this lateral lip, and from the lateral supracondylar ridges. All of this gives origin to the vastus lateralis. It inserts into the lateral border of the patella and blends with the quadriceps tendon. So this entire area in the cross section of the anterior thigh is made by the vastus lateralis. The vastus intermedius arises from anterior and lateral surfaces of the upper two-thirds of the shaft of the femur, and the anterior surface of the muscle is covered by an aponeurosis, which is continued with the quadriceps tendon. Here is the vastus intermedius. It's literally anterior to the femur. Rectus is anterior to this muscle. The vastus lateralis is lateral to this muscle. Now we can see the movements of this. This is the entire quadriceps. Hip extension, hip. The knee extension is done by the quadriceps. It's the main knee extensor. And then also the hip flexion, right? So this is the entire quadriceps working for you. Here we can see a transverse section through the upper third of the thigh, the first one third. This is the anterior area, so this is the rectus femoris, most anterior muscle. This is your femur. Which muscle is this, guys? The vastus lateralis, then the vastus intermedius, and this is the vastus medialis. Here someone, this is your iliotibial tract. The iliotibial tract was made from the this fascia lata, the tensor fascia lata, and also some of the fibers of the gluteus maximus. This is the lateral intramuscular septum. This is the medial intramuscular septum. This is the sartorius. Here they have put the sartorius in somewhat the medial area of the upper thigh. This is the sartorius, and then the femoral nerve, artery, and vein. This is the adductor longus. This is the gracilis. Then there was the profunda vessels, adductor brevis, adductor magnus. Then this was the hamstrings area. We have three hamstrings, the semitendinosus, semimembranosus, and long head of biceps femoris. All three of these muscles were originating from the ischial tuberosity of the hip bone, and this is the sciatic nerve. Now, this is a revision slide for you guys. If you guys want to revise, just stop here and revise. Now, moving on to the anatomy of the tensor fascia lata, it was just a recall that it was innervated by the superior gluteal nerve. The superior gluteal nerve exits the pelvis at the greater sciatic foramen above the piriform missile, which was also the area we called the suprapiriform foramen. And then it supplied the gluteus medius, minimus, and tensor fascia lata. Now there's a femoral sheath. What's the femoral sheath? The femoral sheath is a funnel-shaped sleeve like a stocking, enclosing the upper three-fourth of the 3 to 4 centimeters of the femoral vessels. It's derived from two abdominal fascial layers. Anteriorly, it's derived from the fascia transversalis, which is located deep to the transversus abdominis muscle. And posteriorly, it is derived from the fascia iliaca, which covers the iliacus muscle. So these two layers merge. The sheath, there's an inferior merging. This sheath transitions into connective tissue surrounding the femoral vessels. Here you can see that this is the femoral canal. This pink area denotes your femoral canal. This is the femoral artery, this is the femoral vein, and this is outside the sheath lies the femoral nerve. And these are the lymphatics, specially enclosed into lacunar septa. Now, the compartment of the femoral sheath. The femoral sheath is divided into three compartments by septa. One, two, three. The lateral is the arterial compartment, this lateral compartment. It contains the femoral artery and the femoral branch of the genitofemoral nerve. The genitofemoral nerve was passing anterior to the psoas major muscle. Now, that genitofemoral nerve. Um, gives a femoral branch, and that femoral branch and the femoral artery lies in the lateral arterial compartment. The intermediate compartment is also called the venous compartment because it contains the venous vein, the vein of the femoral canal, and then the medial lymphatic compartment. This one, the one in the pink lined, is the smallest compartment, and it's known as the femoral canal. We can see the femoral canal here a little bit more. This is the transversalis fascia. This is the iliacus fascia. Let me show you here. So this is the transversalis fascia. This is the iliac fascia. This is the inguinal ligament. And this is the artery vein and femoral canal lymphatics. This is 1.25 centimeter long. These are the lymphatics in the femoral canal. You can remember the femoral canal contents with the femoral canal with the boundaries with slip. So we have look at this, we have the septa, where here. So look at this here. This is the inguinal ligament anteriorly. This is the lacular ligament, which was the medial fibers of the inguinal ligament. And behind is the pectineal ligament, right? This is the saphenous opening. Remember the saphenous opening? This is the saphenous opening. The saphenous opening was an opening in the cribriform fascia. And it was allowing the saphenous vein and its branches to come out. Moving on, the femoral triangle. This is very important. The femoral triangle is formed by the inguinal ligament. The medial border of the femoral triangle is made by the um, adductor longus muscle, and the lateral border is made by the medial border of the sartorius muscle. So can you see that this is the medial border of adductor longus, this is the medial area, the lateral border is formed by the sartorius because the sartorius was coming all the way from the anterior superior iliac spine all the way crossing the thigh and going and inserting into the medial condyle of the tibia. So this is how it will form the lateral border of the femoral triangle. And then the floor was made from the psoas major, pectineus, and adductor longus. And sorry, part of it. And the medial border was also made from the medial border of adductor longus. Um, the floor was marked with adductor brevis. It has the anterior division of the obturator nerve on its surface. The superior area is the inguinal ligament. This is the femoral nerve, artery, and vein. So basically, it's formed by the superior part is formed by the inguinal ligament. The medial border is the adductor longus muscle's medial border, and the lateral border is the medial border of the sartorius muscle. It's the apex. This area is formed where the medial and lateral boundaries of the adductor longus and sartorius cross each other, and that is continuous with the adductor canal below. Now we can see the femoral triangle here. This is the femoral triangle, right? It has an apex. You can remember the boundaries of the femoral triangle with the mnemonic SAIL. So sartorius, adductor longus, inguinal ligament. This is the sartorius, this is the adductor longus. Then the pectineus and psoas major with the roofs. This is the pectineus, this is the iliopsoas. They were making the flowed, and then the roof was made by the inguinal ligament, and it was covered with the fascia lata. The fascia lata formed somewhat the roof of it, and then this was the nerve, artery, vein, and the lymphatics. The artery, vein, lymphatics were in the femoral sheath. This was the end of the femoral canal. So the femoral nerve allows for sensory innervation for medial thigh and knee and medial lower leg. That's something it's trying to tell you. Moving on. The femoral triangle. Here you can also see that we have the inguinal ligament, the adductor longus, and the sartorius. Here the floor is formed by the pectineus and the iliacus and psoas major muscle. This is the artery. This is the nerve. This is the vein. These are some lymphatics. Okay. Femoral triangle contents. The contents are the femoral triangle contains important vascular, nervous, and lymphatic structures arranged from lateral to medial. You have the nerve, artery, vein, and lymphatics. These structures are enclosed in the femoral sheath. Only the nerve is not enclosed in the femoral sheath. Now, the femoral nerve is the nerve of the extensor compartment of the thigh. All the muscles of the anterior compartment are the extensor compartments of the thigh. Moving on, it's formed from posterior divisions of anterior ramus of lumbar nerves 2, 3, and 4. I told you there were three roots that were giving origination to the femoral nerve. It supplies the iliacus. Now it's coming and supplying the iliacus first, which is lying in the iliac fossa between the psoas and between the psoas major and iliacus. This nerve enters the thigh by passing deep to the inguinal ligament at the lateral edge of the femoral sheath, which separates it from the femoral artery. This is literally the femoral canal we were talking about. So this nerve comes, it lies between the it lies in the iliac fossa between the psoas major muscle and the iliacus, and both these muscles were forming one tendon that was going into the lesser trochanter of the femur, right? So this nerve passes and it goes deep to the inguinal ligament at the lateral edge of the femoral sheath. This femoral sheath had the nerve outside it. The sheath only has the artery and vein and lymphatics. So that sheath separates it from the femoral artery. Femoral nerve, as it enters the femoral triangle, gives a branch to the pectineus. This branch passes behind the femoral sheath to reach the muscle. So femoral nerve is also supplying the pectineus here, which was originating from the pectineal line of the superior ramus of pubis. Just distal to the inguinal ligament, the femoral nerve divides into several branches. All these branches, you can see the femoral nerve is dividing into them. Femoral nerve. Now, first of all, there are two nerves to sartorius, one of which pierces the muscle and continues as the immediate cutaneous nerve. So the first, you can see here, the first nerve branch goes to the sartorius and it pierces the muscle and continues then as the immediate cutaneous nerve of the thigh. The nerve to vastus medialis, the largest of the muscular branches, passes down on the lateral side of the femoral artery into the adductor canal. Okay, so this is that nerve we're talking about. This is the nerve to vastus medialis, and it's the largest of the muscular branches. It goes on the lateral side of the femoral artery and into the adductor canal, where it gives branches to anterior vastus medialis and continues downwards as the capsule of the knee joint. ठीक है? Moving on to the femoral nerve. Furthermore, the nerve to vastus lateralis runs downwards with the descending branch of the lateral femoral circumflex artery to supply the muscle and knee joint. So here you can see the nerve to vastus lateralis. This is the nerve to vastus lateralis. It goes and with the descending branch of lateral femoral circumflex artery supplies this muscle and then goes down to supply the knee joint also. The nerve to vastus intermedius enters the anterior surface of the muscle and also supplies the knee joint. All these nerves will go to the knee joint and help in supplying the knee joint innervation. The femoral nerve, the nerve to rectus femoris now. This is the rectus femoris. It was the most anterior muscle of the anterior compartment of thigh, and this is usually double. The it gets double innervation. The upper nerve gives a branch to the hip joint, and the lower branch gives a nerve to the rectus femoris. Now, the femoral nerve, just a little revision, it arises from the lumbar plexus L2, L3, L4 nerve roots. It's the largest branch of the lumbar plexus. It emerges from the psoas major muscle, descends into the thigh behind the inguinal ligament, and enters the femoral triangle. It has an anterior division and a posterior division. The anterior division has the medial cutaneous nerve of the thigh and the intermediate cutaneous nerve of the thigh. The posterior division will give you a saphenous nerve which enters the adductor canal but does not pass through the adductor hiatus, which will be see you will see in the next lectures. The nerve to vastus medialis, which enters the adductor canal, and the nerve to vastus intermedius, vastus lateralis, and rectus femoris. Now, the femoral artery is the continuation of the external iliac artery, right? So, coming on to the femoral artery, what are we talking about? When we talk about femoral artery, we should remember that we had the abdominal aorta. The abdominal aorta was dividing into it was giving us two common iliac arteries on both sides, right? So the common iliac artery further divides into internal iliac artery and external iliac artery. The internal iliac artery will give you a superior gluteal artery and an inferior gluteal artery. That's separate. But now let's talk about the external iliac artery. The external iliac artery gives you femoral artery. And this femoral artery, the external iliac artery itself, it continues and forms the femoral artery. And this femoral artery continues and forms the profunda femoral artery later on. And that profunda femoral artery will later on divide to give you lateral circumflex femoral artery and medial circumflex femoral artery. So right now we're only talking about the fact that the femoral artery is a continuation of the external iliac artery. Where does it enter the thigh? It enters the thigh at the mid-inguinal point. Here you can see that it's entering the thigh at the mid-inguinal point here. This is the mid-inguinal point, midway between the anterior superior iliac spine and the pubic symphysis. Okay, it lies on the tendon of the psoas major, separated from the hip joint capsule. There's a femoral sheath that encloses the artery, vein, and lymphatics, just like we saw on the femoral canal. It emerges from the femoral sheath, courses downwards, entering the adductor canal deep to the sartorius muscle. So this is the area of the adductor canal. And then deep to the sartorius muscle, it courses downwards. At the junction of the middle and lower thirds of the thigh, it passes through an opening in the adductor magnus to become continuous with the popliteal artery. So after here, you can see that the femoral canal will pass the adductor canal here and then deep to the sartorius muscle, and then here at the junction of the middle and lower thirds of the thigh here, it passes through an opening in the adductor magnus and comes behind the knee in the popliteal fossa, and it becomes the popliteal artery. So can we see how the femoral artery becomes the popliteal artery? And itself was a continuation, the femoral artery itself was a continuation of the external iliac artery. Now the femoral sheath emerges from the femoral sheath. The femoral artery emerges from the femoral sheath, courses downwards, entering the adductor canal, deep to the sartorius muscle, and then becomes the popliteal artery behind the knee. Femoral artery has three branches. Remember these branches: the superficial epigastric artery, the superficial external pudendal artery here, and the superficial circumflex iliac artery. These are the three branches, the superficial branches of the femoral artery: the superficial epigastric artery, the superficial external pudendal artery, and the superficial circumflex iliac artery. It also has some deep branches that include the profunda femoris artery, the deep external pudendal artery that supplies the genital organs, and then the muscular branches. Here, these are the muscular branches. So in the deep branches, you have the profunda femoris artery, the deep external pudendal supplies the external genitals, and the muscular branches. The profunda femoris artery also has its own story. So the profunda femoris artery, just distal to the femoral sheath, the femoral artery gives rise to the profunda femoris artery. This is the deep femoral artery. This is the main artery of the thigh. It passes between the pectineus and adductor longus and lies on adductor brevis and adductor magnus and terminates as the fourth perforating artery. Here you can see that this is the stem of the femoral artery, and here it's giving you three branches, right? Look at these. This is the lateral circumflex femoral artery, this is the medial circumflex femoral artery. So this is the stem of the profunda femoral artery. The profunda femoral artery will give you a lateral circumflex femoral artery and the medial circumflex femoral artery. The lateral circumflex femoral artery will give you an ascending branch, a transverse branch, and a descending branch. The medial circumflex artery femoral artery will give you an ascending branch and a transverse branch, and itself it will end as the fourth perforating artery. right? So you can see this is the femoral artery, and these are the four perforating arteries, right? Now, the lateral circumflex femoral artery, this I told you, it gives you these three branches. The ascending branch towards the anterior superior iliac spine above. The transverse branch encircles the femur. The descending branch supplies the vastus muscles. Now, the medial circumflex femoral artery, it arises between pectineus and psoas muscle. They contribute to the trochanteric and cruciate anastomosis, and they have four perforating arteries, four branches supplying adductor muscles and hamstrings. Now, the femoral artery division, the entry was at the apex of the femoral triangle. Branches within the canal, you had muscular branches. The descending genicular artery divides into superficial saphenous branch and a deep muscular branch, and it exits through the adductor magnus to become the popliteal artery. The femoral vein is the main deep vein of the lower limb, accompanying the femoral artery throughout its course. It begins at the lower angle of the femoral triangle, where it goes posterior to the femoral artery. It ascends, sorry, here you can see, it ascends within the femoral triangle. The vein shifts position to lie medial to the artery here. So here the vein is lateral. Can you see here? Sorry. Here, your vein is lateral, but as it ascends, it lies medial to the femoral artery. Right? The femoral vein exits the femoral triangle by passing beneath the inguinal ligament, where it becomes continuous with the external iliac vein running along the brim of the pelvis. The femoral vein has some very important tributaries. These are the profunda femoris vein, the great saphenous vein, the muscular veins, and the perforating veins. You have the profunda femoris vein, which join the femoral vein posteriorly, bringing blood from the deep structures of the thigh. The great saphenous vein joins the femoral vein anteriorly, just below the femoral sheath. This is the main superficial vein of the lower limb, and the muscular veins that drain surrounding muscles, and perforating veins that connect superficial vein to the femoral vein. The saphenous vein is the longest vein in the body, by the way. Its origin is it is the upward continuation of the median marginal vein of the foot. The course is that it runs in front of the medial malleolus, crosses the lower quarter of the medial surface of the tibia, and runs behind the medial border of the tibia towards the knee. The saphenous vein lies a hand's breadth behind the medial border of the patella. It spirals forwards around the medial convexity of the thigh and passes through the cribriform fascia covering the saphenous opening, joins the femoral vein about 3 centimeters below and lateral to the pubic tubercle. This is the cutaneous innervation revision. I hope this was helpful for you guys. If you need to learn this or take a screenshot, just pause the video and end it. Thank you so